The Family Medicine Residency program started in 1997, and it started off with a very small number of residents. And we've been able to add more faculty over time and also add more residents as time has progressed.
We are a community program. We're based out of Community Hospital, Pomona Valley, and there are 8 residents in each class. The program is 3 years long, and they are trained in a robust curriculum of inpatient medicine, obstetrics, gynecology, outpatient medicine, and continuity clinic.
We strive to combine the very best elements of family medicine. Graduating from this program, you will definitely become a very competent, strong clinician. However, we also want to focus on helping you develop the skills, giving you the resources to become a community advocate, a physician leader. And we try to do this in a supportive, inclusive environment.
We prioritize the resident experience. We want to make sure that the residents are safe, that they know they're valued, and they know that we care about them.
I pride our program on being flexible in the sense that we like to support residents in whatever interests them and what is going to drive them.
Pomona is very dedicated to the community. It's quite a diverse community, and so that relationship is very special.
The program was actually started with a mission to repopulate the community with physicians that mirror the community and had a passion and commitment to the community.
We want to prepare physicians to meet the needs of the community, to be not only culturally competent, but to be compassionate and to have a strong foundation of clinical skills to be able to assist their patients and to be able to help their patients out there in the community.
We are committed to our community. We are an unopposed program with a robust curriculum, and you will get a full spectrum training here. We have supportive faculty, supportive residents and staff to help you succeed in the future.
I chose Pomona Valley Hospital because I remember my interview day. So I got to interact with a lot of the faculty and the residents, and they just seemed very genuine, very kind. And I remember having a smile on my face because I knew that I wanted to work with them. I knew that we had connected.
Really what drew me was initially the leadership. My conversation with Dr. Diamond, who was the program director at the time, was just really amazing. I could tell just from our conversation that she really cared about the program and about the residents and the quality of the people coming in.
For me, coming to Pomona was mostly about the community that it serves. And I feel that the mission of the hospital, the mission of the Family Medicine Residency program is diversity. It's what led me to come here as well.
Pomona reminds me a lot of where I grew up. Very diverse, underserved community, and having been a patient with language barriers with your physician, it was very important for me to be able to give back to the community, helping people in the same situation that I was in when I was a child.
Very diverse when it comes to culture, diverse when it comes to ethnicities and just different socioeconomic backgrounds. And I think even right now, I'm able to learn about the beauty of all these differences in the population, but also it allows us to be exposed to different pathologies as well.
I wanted to be in a program that is full spectrum and unopposed, where we are the only residents at the hospital really, and the training that we get is always hands-on.
They're very committed to educating people that are socially conscious family medicine physicians. They're also very committed to just having a broad spectrum training for family medicine. That's something that I definitely wanted to be a part of.
I'm happy to be at Pomona Valley Hospital because I really believe this program is going to educate me and help me get to where I need to go.
I've been able to find everything that I'm looking for here, working with the community that I wanted. Really broad spectrum training from inpatient to OB, family medicine to geriatrics, to behavioral health.
If you just wanted to come straight out of residency and practice the full scope of primary care, you'd absolutely be qualified and ready and prepared from infanthood to geriatrics.
Coming out of med school, I had a very broad training. It was a 6-year medical education that included disaster medicine, internationalism, and I really wanted to hold on to those skills. I feel that Pomona Valley has really prepared me for really any situation.
I like that in this particular program, you can get a really well-rounded education, but you can also do your tracks to specialize.
And if you have any new ideas for any of the program, they're always willing to work with you and willing to make that happen for you. If you're interested in creating a certain track, if you're interested in creating a certain event, you will always feel supported.
I also have a special interest in border health, and I found that the location where this program is allows me to do a lot of that work as well on my free time. The program has been very supportive of my work down there, and I really appreciate that as well.